Well, I'm Sue from Chapel Oak Practice in North West Leeds, and I've been living in Leeds for the last 10 years, moved up from London. I was diagnosed with rheumatoid arthritis in January 2008, and from then I've had quite a lot of health problems and on quite a lot of drugs now. 6 now, different disciplines. So I see my consultant at the hospital, rheumatology. I see my GP. I see the bone shoulder man for problems with my shoulder. I see the foot bone man, and I see the eye man, and I've also seen a neurologist. So quite a few. It's quite difficult because obviously they don't talk to each other, and you end up repeating yourself when you're visiting with your appointment, and of course that also wastes time. So you're telling them what drugs you're on, or the results of certain tests, and that eats into your appointment time. Well, that's going to enable different disciplines to be able to bring up patients' records, and it's going to be very brief records, but things like blood tests will be available, prescriptions will be available, any allergies or any problems that people have with their drugs is going to be available, so you don't need to repeat yourself. My understanding is that it's not going to be the whole of the medical records that's going to be viewed, it's just going to be certain aspects of it that's going to be viewed by the professionals. But it's going to be better joined up, isn't it? And of course, if someone has a site of my medication, I don't need to then repeat myself. I will always need to have with me the medication that I'm on, but I don't need to then eat into my appointment time by explaining what drugs I'm on, what reactions I've had, and also things like the blood tests. At the moment, my GP can't see the blood test from the hospital, but the hospital can see my blood test from the GP, and obviously that's then going to change. That means that both partners will be able to see blood test results, and it will mean a quicker diagnosis for me as well. Yes, I would. I mean, as I say, it's only limited information. It's not a full medical record, so people could be assured they're not going to have everybody seeing it as well. It's only limited. It's going to be limited to various professionals. The minor side to me is that it's not going to be available if I move out of Leeds or if I go on holiday, which is a bit of a pity, but obviously, one step at a time.